DeSantis continues war on children with rowdy Medicaid hearing on LGBTQ plus healthcare.
Good afternoon. My name is John Harris Maurer, and I'm the Public Policy Director for Equality Florida, the state's largest civil rights organization based on securing full equality for Florida's LGBTQ community. The proposed change to Rule 59G 1.050 is without sound scientific basis, it is without legal basis, and it is clearly discriminatory. The agency should reject it. The proposed rule is about politics, not public health. We urge you to listen to the numerous medical professionals opposed to the rule. Experts from the country's and the world's leading health organizations disagree with the fundamental premise of the proposed rule. They endorse gender-affirming care. These organizations represent millions of medical professionals, and they recommend gender-affirming care. We're talking about the American Academy of Pediatrics and its Florida chapter, the American Medical Association, the American College of Obstetricians and Gynecologists, the American College of Physicians, the American Psychiatric Association, the American Psychological Association, the American Academy of Family Physicians, the American Academy of Child and Adolescent Psychiatry, the Endocrine Society, the Society for Adolescent Health and Medicine, the Pediatric Endocrine Society, the World Professional Health Association for Transgender Health, and others. Again, representing millions of medical professionals. Furthermore, AHCA lacks the specific delegated rulemaking authority to adopt the proposed rule. The statutes that AHCA names as its authority to make this proposed rule grant no authority for this usurpation of the individual role for healthcare practitioners to make decisions with their patients. The rule is simply discriminatory. It undeniably targets the transgender community. You may not understand what it's like to be transgender, but to be the parent of a transgender kid just trying to find the best care for your kid. But transgender Floridians are here in this audience, and they are telling you about how harmful this rule would be to the more than 9,000 transgender Floridians on Medicaid. We know these therapies are safe because the agency is not opposing them for health reasons. In conjunction with the state willingly ignoring the body of scientific evidence that supports gender-affirming care, there is no question of the politically calculated animus behind this proposed rule. Please reject the proposed rule.
On Friday, a public hearing was held before the Florida Agency for Healthcare Administration, or AHCA, in Tallahassee. The hearing was intended to consider a proposal by Governor Ron DeSantis' administration that would deny Medicaid insurance coverage for gender-affirming care for low-income transgender individuals, including hormone treatments and puberty blockers. More than 70 speakers registered to present their opinions and positions on the topic, and the crowd continually got rowdy between presentations as members of the audience would cheer or boo depending on if they agreed with the position given. A decision about the policy has yet to be reached.
What do you notice in that list of organizations he mentioned? They're medical, they're scientific. There were no religious organizations. Did you notice that? It was all fact-based organizations that were his resources, that were the sources.
And those fact-based organizations are powerful organizations.
Of course, legitimate, yes.
You know, I've talked about this before in previous, shows, is the cruelty that Ron DeSantis and his administration has shown. When we go back to 2016 and Donald Trump picked the Muslim community and the Mexican or the Latino community as the scapegoat and made it the
wall and all that.
Right,
yeah.
he made it his the first thing that he said when he came down that elevator or escalator, sorry. And he picked that. It worked out for him. It was very effective. He won that election. Ron DeSantis is repeating the same formula. This time he's picking on the
little kids, on transgender children.
Community.
Oh yeah, but what a bully! My God.
The cruelty of his approach. I mean, just basically blocking Medicaid funds for them when the transgender community is already in high, dire straits situation where they need these funds.
Absolutely.
The cruelty, and these are the people that claim to be the Christian community. I just don't understand how you can claim to be a Christian and act this way just ideologically doesn't, align with your point of view.
Well, and your description is spot on, Dino. Cruel, like cruel. Think about that word. That's really what it is. And who needs Medicaid, right? the underprivileged, right? The marginalized, the poor.
Exactly right.
And these are the people that you're going after.
And this is expensive medication.
Exactly right.
Very expensive. So what happens to a kid that is going through this transition right now and now can't have any more medicine?
And like we discussed before, I do understand that not everybody may want to choose to go this way at an early age. This is a decision for the individual, the child, or the teenager, their parents, and their doctors, and the, their therapists. This has to not for these politicians to decide on what my child or me as a teenager decide to do with my life. I'm saying this should not be approached lightly. Of course, that child or that teenager should be guided medically, by a therapist, but not by Ron DeSantis, not by the healthcare administration of the state of Florida. That is irresponsible.
It's irresponsible. And then they label it as like a parental, like stay gay, like don't say gay.
Right.
Oh, parental rights. We're just trying to protect the rights of the parent.
It's the new catchphrase. Right.
No, and they call it child abuse in Texas.
Right.
And, and there's healthcare providers that are just afraid of dealing with anybody LGBTQ+ because of stories like this, where they're like, I don't want to get reported. I don't want to lose my license.
Right, that's what the state attorney of the state the state of Texas had decided that this is what's going to be persecuted as a child abuse case. So basically, the parents may lose custody of this child.
And it keeps going back and forth. It keeps being stayed by judges, and then sometimes it's back on. It's got to be exhausting for the people going through this.
It's got to be exhausting for the parents. It's got to be exhausting for all of them. Just imagine going through, okay, I'm going to transition. I'm going to start blockers. This is what I'm doing. All right. And then no more. I won't be able to be who I truly am inside.
The thing that worries me the most, if something like this were to pass, and I hope to heck it never does, is the psychological damage that's going to be instilled in this person who just couldn't get what they needed. It's so simple. Give them what they need, what they've soundly and profoundly discussed with their parents, because we are talking about minors, who are smart enough now to have more open discussions with their parents.
But the thing is that he, as the governor of the state of Florida, legally chosen, by a narrow margin, but yet he gets to decide where the Medicaid funds in the state of Florida go to. When he blocks that is going to be...
It's going to happen.
It's going to happen.
This is a nightmare.
We'll be following this story for sure.
LGBTQ+ news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Laura are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ+ community.